Gwen, I'm having recurrent vaginal itches. I have watched your videos and I'm still having recurring vaginal itches. I've been to the hospital, I'm taking drugs, but it still keeps coming. What could be the issue? Good day, everyone, and welcome back to my channel. I'm Gwendolyn Haller, a seasoned medical professional, and I'm here to bring you the juice. If you're a returning subscriber, this is me saying I love you. If you just hopped on this channel and you're watching this video for the first time, you're welcome. I love you, I love you, I love you. And if you have been watching, if you have been sharing and commenting, and you have never smashed that subscribe button, please do so. Show me extra love. Let's roll it. Welcome back. We'll be talking about the unclean penis that causes vaginal infections. For several years and for several decades, everywhere you go is often being told that the woman is the cause of her vaginal infections. Either she stuffs things into her vagina, either she doesn't clean in the right direction, she cleans from the back to the front, she cleans from her anus to her vagina area, or either she wears damp underwear, either she takes antibiotics and for a very long time, or either she's not hygienic or she doesn't use the toilet properly. A lot of information out there to guide the woman on how to keep herself clean, on how to keep her vagina healthy, not to douche, all of that. And a lot of women are doing this day and night. Then I started thinking, I got this revelation the other day, that what could cause my viewers to keep telling me they're having these problems? Have you also thought about a man whose penis is unclean? Then I began to study about it. And I realized that there are a lot of men who are responsible for vaginal infections in their wives, recurrent vaginal infections in their spouses. And this is what I'm going to say. I did a video on things you should put in your vagina, and I'm going to leave this at the end screen so you watch. There were a lot of comments. Some people sent me emails telling me how they shared that video with their husband, and some men who watched it shared it with their spouse. And I told females, don't allow a man to take your sexual health, your reproductive health for a ride, for an adventure. A lot of men are naive about feminine hygiene, and a lot of women are, and even men themselves are naive about masculine hygiene. Now, there are a lot of men who are not hygienic down there. You will see a man who has hyperpigmentations and discolorations around his groin, around his pubic areas, around his balls, and you think that is normal. That's fungi. Now, as a lady, if you don't take care of yourself, and if you don't teach this man how to take care of himself, he will be the first man to tell you that you smell, you're dirty, you're unhygienic, you sleep with different men, you have sexually transmitted diseases. It's not gonna end. And if the man is immature, he will start telling other people that you stink. That is why he doesn't want to have sex with you, because you stink. Now, if you are a lady and you have been doing everything I have taught you in my videos, I'm going to share the video on fungal thrush and also bacterial vaginosis and also recurring vaginal issues. You need to watch. But this video is to help you as the woman and the man know how to prevent vaginal infection caused by an unclean penis. Now, this is not a video that you will find anywhere or information that you will find everywhere. So if you know somebody who needs this info, please do share it with them so they are inspired, so that they can protect their health, they can stay healthy. Now, the first thing you have to know is that a man who is uncircumcised has a higher chance of infecting his partner or wife with vaginal infections. Men who are circumcised can do so if they don't shower, or if they have urinary tract infections or other sexually transmitted diseases. Remember that many men have urinary tract infections, have sexually transmitted diseases, have infections on their manhood, their penis, but they are asymptomatic. They don't show any signs. They don't show any symptoms. And I want to encourage every man, when your wife is going for yearly checkup after every 4 months, which you should do, even though you have just one wife, please follow her. Because you can have a urinary tract infection, not that you're sleeping with other women. You can have other forms of infections, not that you are promiscuous, but because of inhygiene. Remember that if you are uncircumcised, there's a high chance that microorganisms will grow and hide themselves under the foreskin. I'm going to do a video to explain this. There's phimosis. Phimosis occurs when the foreskin tightens at the tip of the man's penis. There's paraphimosis. A man can also have balanitis. Balanitis, a man can also have penile cancer. Now, when a man is uncircumcised, he has smegma. Smegma is an accumulation of dead skin cells, sweat, microorganisms, moisture underneath the foreskin. And if the man doesn't pull back his foreskin and wash properly, what's going to happen is when he flushes himself into his wife, everything is going to go into his wife. That's what's going to happen. That is why many women have recurrent vaginal infections. Now, if the man doesn't clean himself properly and that smegma accumulates, it will lead to balanitis. Now, balanitis will further then link to phimosis. And if the man is not careful, these microorganisms could enter through his urethra and cause him urinary tract infections, which he could also get from the woman if he transfers this smegma, these microorganisms, into the woman. Now, her discharge or her secretions could just go straight into the man. Straight into the man. And this could occur if the man doesn't pee immediately after sexual intercourse. Now, if the man doesn't take care of that, if the man is not hygienic at that time, he doesn't go to the hospital, it can lead to penile cancer. There are several men who have had their penis chopped off because a cancer, a growth, or some form of lesion has really taken over his penis. So what are you supposed to do to prevent this from happening? Now, I'm talking to both male and female. First thing you have to do is you have to check for the symptoms of any infections. Now, if you have pain while urinating, pain while ejaculating, if you have to check your balls. Second, you have to examine the penis for rashes, for bumps, for any inflammation, any swelling, any redness. Check your balls as well. If you have any pain around your balls, head to the hospital. Third point, your husband, whether he's circumcised or not, must shower before sex. That is not a negotiation, especially if he's uncircumcised. If possible, you, the woman, can teach your husband how to wash himself. Or why not give him a bath, give him a shower, pull the foreskin back, clean it, wash him, clean him properly. Then you guys can have sexual activity. And this is important. Fourth point, the man must change his underwear on a daily basis. You can't wear underwear that carries microbes where you pee and you don't even clean the tip of your penis, and you insert this into the woman, all your microorganisms just go straight into her. Microorganisms from the leftover urine, present urine, leftover past urine, leftover sweat, dead skin, and the growth of bacteria and fungi, you flush this into the woman. As it touches your penis, you flush this into the woman. Your man must change his underwear every day. The next point, check your pre-cum and your cum. Check all your discharges. Your discharge before you ejaculate and your ejaculation. Look at it for color, for the smell, and for the texture. Now I'm going to do another video on this. But know that as a man, don't be selfish. Consider your wife. Take some time to study feminine hygiene. It is your responsibility as a leader, as a head of a home, to make sure that your wife is in good health. You have to help her protect her fertility, protect her sexual health. You have to help her to have a healthy vagina so you both can have a healthy sex life and intimacy. Then I want to leave you with this. Douching or sending things into your vagina, water, salt, and all that will not take out these microorganisms. Sending your hand into your vagina to take out those discharge or color discharge before you have sex will not change anything. It will only make your situation worse. Remember that there are a lot of men who have candida, who transfer candida from their penis to a woman's vagina. And this is why a woman is constantly having vaginal infections, vaginal itches, what some people will call sugar, funny discharge, smelly discharge, because a man is not hygienic. So I want to plead with all men, before you get married, know these things. Teach this to your wife. And as a woman, know these things so you can teach your husband before you get married. And if you are married, it's not too late. Both of you should go to the clinic, do some tests, and then when you guys are off medications, make sure you practice good hygiene. It's very important. This will help you enjoy sex more. Thank you so much for joining me in today's class. I remain your seasoned medical professional. Bye-bye.